If you or your child has scoliosis, you've probably come across two very different types of braces. One is soft, flexible, and looks more like clothing, and the other one is rigid, custom designed, and really highly structured. But here's the real question: do they actually work the same? Hi, I'm Dr. Chris Gould, the head clinician here at ScoliCare Denver, and today we're going to break down the real difference so you can make an informed decision for you or someone in your family. Now, most people assume that they do the same thing, but the reality is they don't. And choosing the wrong approach at the wrong time could be missing a critical window to influence the spine in the most effective way. So in this video, we're going to break down the real difference between soft and rigid braces, what the research actually says, and how to decide what may be the most appropriate for your specific case. Now, scoliosis can be really confusing, and you're going to hear all different types of opinions from different providers. You'll likely find very conflicting advice online, and it's not always clear who you should listen to. Now, at ScoliCare Denver, our focus is real simple: to help patients get the right treatment at the right time. Because scoliosis is not a one-size-fits-all condition. Every curve is different, every patient is different, and every treatment needs to reflect that. So let's start by better understanding what these braces actually are. Now, soft braces like SpineCore or activity-based suits are designed to be flexible, movement-friendly, and worn like a harness or a suit. They typically use elastic bands or straps to guide the body, and the idea behind them is to aim to encourage postural awareness and promote movement-based correction, and really to support neuromuscular re-education. In simple terms, they work with movement rather than restricting it. On the other side, we have rigid braces. These are typically custom designed using scans and x-rays, and they're structured to fit the individual body, typically worn under clothing. But here's where modern bracing has evolved. While many rigid bracing methods, such as the Boston braid that's typically used at most hospitals, still focuses on trying to stabilize the spine using a method called 3 points of pressure, which basically tries to squeeze the spine and hold it in place, almost like a cast. Whereas ScoliBrace 3D design braces are not just about holding the spine, but they're actually designed to improve spine alignment in the right types of cases. And they actually guide the body into a more corrected posture, and they influence how the brain and muscles and joints interact over time. The goal with ScoliBrace is not just support or stabilizing in young adolescents. It's actually postural correction and adaptation. So what's the real difference? It comes down to force and control. Soft bracing uses low external force, relies more on active movement, and emphasizes neuromuscular training. And rigid bracing uses higher corrective forces, provides structural guidance, and aims for measurable alignment changes with the specific types of cases. So it isn't just soft versus hard, it's low force versus high force corrective strategies. Now let's talk about the evidence backing these different types of braces. First, rigid bracing has a lot of strong evidence in the scientific literature. And one of the most important studies for scoliosis care is known as the BRACE trial. And the BRACE trial was a landmark study that found that bracing significantly reduced the risk of curves progressing to surgical levels. About 72% success rate with bracing versus about 48% with observation only. Now, this paper on its own is one of the key reasons why rigid bracing is widely accepted in the guidelines for scoliosis management. When we look at SpineCore soft brace research, there is some research in the scientific literature supporting SpineCore. Now, in that study, 35% of the patients using the SpineCore brace progressed to surgical levels, compared to 5.6 in rigid brace control groups. Now, many of the patients that progressed needed to be transitioned to a rigid brace, and once they were transitioned to rigid brace, they had successful outcomes or the curve stopped progressing. So what this study suggests is that soft bracing may have a role, but may be less effective in higher risk cases. Now, when you think about the ScoliSmart Active suit, there's very limited evidence. In fact, for activity-based suits like the ScoliSmart Active suit, there's really no high-quality randomized trials, and most of the data comes from case reports and internal studies. I did a search on PubMed, and I couldn't find any randomized trials or any studies about the ScoliSmart suit. And when doing searches using some large language models like ChatGPT, it couldn't find any large studies to support those other than internal studies. So the ScoliSmart Active suit currently sits in the lower evidence category for research. Now, if we talk about the ScoliBrace and 3D bracing, there is new emerging research showing improvements in posture and alignments. And what we know when we're thinking about braces that have the likelihood of reducing curves, higher in-brace correction is associated with better long-term outcomes. we know that higher in-brace correction is associated with better long-term outcomes. This really aligns with the 3D corrective philosophy used in modern bracing like the ScoliBrace. So here's a nice recap looking at those studies I was talking about. When you're looking at the brace study, that showed that 72% of patients that were braced did not end up having surgery. Compared to those that did not get braced, only 48% of the patients did not progress to surgical levels. Now, what's interesting about this paper is the braces were so successful that the study had to be stopped because it was considered unethical to not let patients that did not have a brace not have the chance to get the brace, because the study results showed if they wore a brace, they were much less likely to progress to surgery. This down here is the study looking at when patients were given a rigid brace versus a spine cord brace. And these were all adolescent idiopathic teenagers that had progressive scoliosis. And those that got a rigid brace, 94.4% of those did not progress beyond 5 degrees or surgical levels. And for the spine cord brace, over 65% of those did not progress. And a lot of the patients that were started with the spine cord brace ended up being transitioned into a rigid brace. So here's the key takeaway. Support is not the same as correction. A brace can feel comfortable, it can improve posture temporarily, but the real question is it influencing the underlying curve progression? Now, rigid braces are typically designed to place the spine in a more correct position, applying consistent corrective forces, while softer approaches often rely more on patient movement and overall engagement. So when might it be more appropriate to use a soft brace or a rigid brace? Well, this is where clinical decision making really matters, because the right choice depends on several factors, including curve size, flexibility, the amount of growth remaining, and the risk of progression. So soft bracing may be considered for smaller curves or earlier stage cases, or cases that have a lower progression risk, and also when they're part of an exercise-based program. And rigid bracing may be more appropriate for moderate to larger curves or curves with a higher risk of progression when structural correction is needed and is the primary goal. Now let's clear up some common misconceptions. One misconception is soft braces are always better because they're more comfortable. That's not necessarily true. Comfort depends really on fit and the design. And many times a properly designed and fit rigid brace can be more comfortable than a soft brace. Now, another common misconception is rigid braces weakens the spinal muscles. Modern approaches often combine bracing with scoliosis-specific exercise. In fact, ScoliCare recently did a study where we looked at adolescents wearing a rigid custom Scoli brace 23 hours a day and doing scoliosis-specific exercise. And we measured the abdominal and erector trunk muscle strength and endurance before the start of bracing and after bracing. And 100% of the subjects actually had an increase in abdominal and erector muscle strength and endurance. So we know that there's no evidence supporting that custom rigid braces like the Scoli brace actually cause muscle weakening. In fact, we have research that shows the opposite. And another common myth is all braces work the same. They don't. Design philosophy matters, force application matters, and customization also matters. Now, what role does exercise play in scoliosis treatment? Regardless of the brace type you're in, exercise is critical. And programs like ScoliBounce, scoliosis-specific rehabilitation, can improve muscular strength and support, and it's a key component in getting positive outcomes in scoliosis-specific treatment. And a proper scoliosis rehab program actually complements bracing, and bracing and exercise don't replace each other. They actually work together to help get the best possible outcomes. Because when we really look at it, scoliosis treatment is about reducing the risk of curve progressing, improving posture, and enhancing overall quality of life. So no matter what type of brace you get, earlier detection and treatment leads to better overall outcomes. So how you choose the right brace, the most important step is not choosing a brace, it's getting an accurate assessment, because the decision should be based on curve size, remaining growth, flexibility, and the patient's individual goals. Now, if you're watching this video, I'm assuming you or someone in your family has scoliosis, and you're probably trying to figure out what's the most appropriate treatment for you. And so it all starts with getting the proper assessment. Now, I'm going to encourage you to click on the link below and request a free discovery call. That'll give you a chance to talk to me one-on-one about your scoliosis. We'll go over the severity, how likely it is to progress, and which treatments you're a candidate for and are most appropriate for your individual spine. And to learn more about the most effective non-surgical scoliosis treatment options, click on our next video and I'll see you there.